Therapy from the University of Pittsburgh. Her clinical experience spans outpatient occupational therapy, where she has treated a wide range of multi-skeletal, neurological, and chronic diseases. She specializes in chronic condition management, supporting patients with chronic fatigue, chronic pain, autoimmune disorders, hypermobility, and more. She completed her programs and training related to chronic pain, and holds a certification in empowered relief and mental health first aid. Sarah is also involved with the Pennsylvania Area Health Education Center, where she is the director of the Health Center Career Pathways Programming in the Southwestern region. So let's welcome Sarah. Thank you.
Hi, everyone. It's good to be here. I'm Sarah. I'm an occupational therapist. I live in Swiftley, but can't hear you. Oh, sorry. I live in Swiftley, so it's great to be able to be with you. Thanks for spending the morning here. So I wanted to talk today about how occupational therapy can support people with arthritis, whether that's rheumatoid arthritis or osteoarthritis or any other type of arthritis. Not just about managing symptoms, but continuing to do the things that are important to you despite having those symptoms. And one of the most important things to understand is that arthritis doesn't just impact your joints. It impacts your day-to-day life. It impacts the way that you interact with your family, with your friends, at work, doing things that are important to you, hobbies, social activities. Sure. Okay, yeah, thank you. But also how you rest and recover. So over time, it can affect your confidence and what you're able to handle, what you're able to do. And I know that's very much in self-efficacy and self-management. So that's really where occupational therapists can step in to support you. So my goal today is to give you practical strategies that are realistic, that you can take home with you and hopefully start to implement right away. And these types of strategies don't require perfection. They require practice. They require flexibility, being kind to yourself, and over time, the changes start to most So before I move into the rest of the slides, I wanted to ask everybody to just think to themselves about if you have arthritis or you know somebody with arthritis, what is something that's hard for you to do? Is it getting the dishes done? Is it getting the bathroom clean? Is it holding your laundry? Everyday types of tasks, or is it something different? Is it a hobby that you have that you've not been able to do as much? So keep that in mind. It's everything that we talk about together today meant to support those types of activities. Great. How many of you are familiar with occupational therapy? A couple people, great. I know it's sometimes something that gets confused with physical therapy, but we are two distinct things. Occupational therapists focus on your daily life. When we use the word occupation, we're not just talking about work or what you might do for a job. We're talking about every activity, task that fills your day. Everything that gives your life structure and meaning. So basic activities like getting dressed, getting washed up, eating, but also more complex activities like cooking, managing a social calendar, managing your home, taking care of people, hobbies and social activities. And what makes OT different is that we're not only focused on the symptoms a person is experiencing, but focusing on how those symptoms impact the person's ability to function, including things that are important to them. So my job as an OT is to help people figure out how to do things that are important to them in a way that works with their body, works with their energies, works within their functional capacities, rather than against them. That might mean changing how you do something. It could mean changing when you do something, how you do it, or how long you do it, or what types of support you may use. So instead of asking, how do I get rid of this problem, these needs, I'm asking, how can I help you live your life alongside these symptoms in a way that feels manageable and meaningful, so you can do the things that are important to you. So arthritis can affect daily life in a number of overlapping ways. There's the physical side, pain, stiffness, reduced strength, and those can make tasks that used to feel simple suddenly feel really difficult and hard to do. And there's also sometimes fatigue, which I think can be underestimated in how much it can impact a person. That might not just impact your physical energy, but impact your mental energy, how much clarity you have in thinking and making decisions, perhaps. And because of this combination, everyday activities can start to feel overwhelming. Things like getting through the morning routine, getting through the workday, cooking dinner, cleaning up around the house, can start to feel a lot more effortful. They take more time, they take more energy, more planning than they used to. And over time, people don't just have difficulty with these tasks, but they start to avoid them. Movement is another one. Movement is so good for the body, but very understandably, arthritis makes it hard to move. It's painful. So people want to avoid it so they protect themselves from the pain. But that's not good in the long term. Avoiding things that are important to us or necessary to our daily lives is hard and not a good thing. And that's exactly where OT can fit in and help. By finding ways to stay engaged in those activities despite symptoms, and in a way that feels more doable and more overwhelming. Another thing that I wanted to highlight is that this isn't just about the physical difficulty that comes with having these symptoms, but sometimes it's about the unpredictability. Depending on the type of arthritis you have, perhaps, or depending on other health conditions that you experience, your symptoms might ebb and flow and flare in a way that's difficult to. So there's really, maybe it doesn't feel like a lot of pain that you actually can do. And that makes getting through life significantly harder, I think. It's difficult to commit to things, difficult to feel confident in what you're doing and what your body can control. So part of, again, what we're working on in OT is reducing the symptoms, but also increasing your ability to navigate the unpredictability or the variability in your symptoms. So in OT, we tend to focus on a few core approaches that can make meaningful impacts. The first one I want to talk about is energy conservation or pacing. This is a way to help you manage your cleaning or your energy in a way that avoids a cycle of overdoing and then paying for it. The second one I want to mention is joint protection. So looking at how to reduce unnecessary strain on your joints during everyday activities. And the third is my favorite. Well, pacing is kind of my favorite, but I really also enjoy activity modification. And that's changing how tasks are done so that they better match your current abilities and strengths. And you'll see that a lot of these approaches overlap. There's a lot of common threads that connect them together. For example, modifying an activity might also incorporate joint protection strategies to minimize joint strain and conserve energy, and that can all happen at the same time. But importantly, these strategies are not about doing less or giving things up. They're about doing things differently in a way that allows you to still participate in things that are meaningful to you and important to you with more consistency. That's great. These types of strategies are most effective when they are used together. So keep that in mind. And they're definitely not isolated techniques. They're part of a bigger shift, how you approach your day and how you approach life. So as we go through these different ones, I want you to remember that activity that I asked you to think about earlier. It's something that's hard for you to do and how these might apply to that activity. So energy conservation. I do think this is my favorite just because I've grown to think about how to pace in very abstract ways. This can be one of the most impactful ways of managing pain, of managing fatigue, of managing any kind of difficult to manage symptom, regardless of what condition it comes from. A lot of my patients describe this pattern where it feels a little bit better one day. They try to catch up on all the things that they've fallen behind on, and they end up feeling significantly worse after. Has anybody experienced that pattern? know I do. I have a slow day and the next day I'm like, oh, I don't even feel better. It's like I have to catch up at this point because I'm so far behind. So we call this the boom and bust cycle. They might have other names. This is the one that I think is the most common. It's really difficult. This is a really hard cycle to get out of. It takes a lot of effort. And part of that is because this isn't just a physical cycle that a person is in, it's emotional and psychological as well. A lot of us have expectations about what we should be able to do, or we remember what we used to be able to do. We might feel pressure from ourselves or from people around us to keep up in a certain way. And expectations aren't a bad thing. However, that mismatch of what we expect ourselves to be able to do or others with what our body is able to actually produce can put us right back into that cycle of the boom and bust, where, our body's pushing back again. So pacing in a very real way involves a lot of compromise in trying to approach tasks. You can be taking longer to do something, or doing it in a different way than you're used to, and that's frustrating. Nobody likes change really. I don't really love things that much, but it's important to be able to do. So what I want to emphasize with pacing is that the long-term benefit significantly outweighs any short-term inconvenience that comes from changing your daily things. Because when you start to pace more consistently, you're giving your body more time outside of the boom and bust cycle, and that more stable space is what allows symptoms to become more predictable and more manageable. When that happens, you actually have a greater chance to build up tolerance to activity over time. So you might notice that you're able to do a little bit more and eventually have to rely less on these changes and adaptations that you're making. So from a practical standpoint, this can look like resting and taking breaks. It can look like alternating between heavier tasks that involve a lot of lifting and moving with lighter tasks that don't require as much of that. And importantly, when it comes to community, building those rest breaks in before you can need peak, before your pain starts to become out of control or as worse. That is the key to pacing, is building those rest breaks in before you absolutely need that. And we also look at prioritizing, because if you have a limited capacity, prioritization becomes really important. We still have the same amount of responsibilities. The number of things on our to-do list haven't suddenly shrunk. But we have to figure out, well, next time I have to prioritize getting myself together for taxes. That has to happen. And then I can fill in some other things along the way. So it's a lot of life management strategies. And I have a couple of these on the screen. I'll just call attention to the one in the middle because I like that one the most. I call it the stoplight guide. And the objective of a stoplight guide is an analogy that can help people determine, well, I wake up and I'm feeling good. It's a green light day. Here are the strategies I can use to make the most out of this day without overdoing it. A yellow light day is, could be better, could be worse. A red light day is not good. I'm in a big pain here because symptoms are really acting up. And the objective there is to identify what can I do to best support myself on these different days. Also could be morning to me tonight for the shift. So, yeah. So this is a slide that talks kind of about how energy conservation can look. And I'm a very visual person, so hopefully this kind of puts my words into, better perspective. So the top graph is meant to represent how a person's activity level changes when they're not practicing pacing. So the red line that squiggles is meant to represent the boom bust cycle. So as that cycle continues, the person's activity level will decline. When you're in that cycle for too long, that's just what happens. But if you do pace, this green squiggly line, you're still going to experience the boom and bust, but your peaks and valleys of pain, of symptom flare, may not be as intense. So the amplitude of the waves is a bit smaller, and because of that, your activity level can remain more consistent, and that is important. Oh, joint protection. You know what? I love all of these strategies. I can't pretend that I have favorites. Joint protection is really cool. It's about being more intentional in how you move your body and how you use your appendages and joints to do the things that you need to do. One example is to use your larger, stronger joints instead of your smaller joints to take the strain off of them. For example, if you're carrying a dinner plate, not to hold it in one hand, put other things down, practice pacing in that regard, and use both of your hands to carry that dinner plate. Laundry basket on the hip. Just use both hands. It will pay off in the long run. So minimizing tight pinching and gripping too is important, especially during repetitive tasks. And there are a ton of different tools, adaptive tools and equipment and other types of supplies that I'll talk about that can reduce that strain. So these changes with joint positioning in particular, they might seem really small, but if you apply them consistently over the course of the day, from day to day, from week to week, it does significantly reduce the irritation and pain and the likelihood of flare-ups over time. So a helpful way to think about joint protection is that it's not just about avoiding pain in the moment, but it's about reducing cumulative stress to your joints over time. So a single moment might not feel like a big deal, but it does add up. My pictures in here I'm excited about, especially because we have these really awesome watercolor books on our table. And if you notice, they have everything you need in them. There's little paint patches on them, and in the back, there's even a brush. So in the top picture here, it's Coban. Coban, it might have a million other names. That's probably his brand name. And I always joke that Coban should pay me because I talk about them so much. I love Coban. There are so many different ways to use it. I brought some today, so if you want some, I have a ton to take it out. It's stretchy, it's self-adhesive, and you can use it in a million ways. And the way I did to show everybody today is I built up the grip of the paintbrush in the back of your booklet. And this is important, building up grips, because if you don't have a built up grip, you have to press your fingers really tightly, or it's a much smaller object to hold on to. But if you build it up, it's a little bit bigger, so it is less strain on your joints. And with Coban, you're actually getting a little bit of cushion in there too. So the force that you're pushing into the object, whether it's a paintbrush, a pen, a pencil, a fork, spoon, nuts, anything, that force doesn't get pushed right back into your joint to make it much higher than the pain there. It gets absorbed right up. So I love those. I have another picture of a device that can be used for keys. A lot of times that pinch that you use to hold on to a key, put it in the door to twist it, that can be really painful on the hands. So they use all sorts of different devices to help use a wider grip. You can even put Coban on the blue thing to make that even easier and more efficient. And a lot of times too, instead of Coban, you might see this tubing, it's foam tubing, and it comes in different diameters and can accomplish the same things for them. So, small changes reduce pain over time. Okay, and then another good activity modification. This is where in OT we can really start to personalize what activity modification looks like. I want to know what kinds of activities are important to you so I can help you break them down, find where the pain points are, and talk about how you can approach those pain points in a different way that makes it most painful. This could mean sitting instead of standing while you're folding laundry or chopping vegetables for dinner. It could involve organizing your environment so that items you're using more frequently are easy to access. I use everything but the Dale's using all the time, and I just keep it on the counter where I can see it. So I don't have to keep going back and forth between the cabinet. Sometimes this can be about using adaptive equipment again, or about timing. So doing more demanding tasks at a time of day when you know your symptoms are going to be active, for example. And it's important to note that these kinds of changes aren't about lowering your expectations, which we should be able to do, but it's about creating a setup that supports you and what your capacities are so that you can be successful. I think I hear a lot from people that modifying activities can feel like a person is giving in or they're giving up and they're letting their symptoms, their condition kind of take the wheel. But really, it's about supporting yourself to do something that's important to you without suffering for it. And I try to remind people that a lot of these strategies, again, they don't have to be forever, but they can be for now to help you get to forever. And so to kind of continue with my fun graphs, same kind of idea where with pacing, with joint protection, with activity modification, a person does have the capacity to see their activity level improve over time because they have done a lot of small things to better manage their symptoms. So I wanted to give you a real life example to something pretty common like cooking about different strategies you can take to reduce joint pain and fatigue using some of these strategies. So thinking of cooking, it's easy to kind of think of it as one task, but it's actually made up of a lot of smaller tasks. It's a very demanding activity. Standing, reaching, gripping, lifting, carrying, bending. Those are all the kinds of verbs that I'm thinking of as somebody's telling me about process, especially when they're cooking. So by breaking it into parts, our body is better able to handle the cumulative impact of something like cooking. So perhaps a person can prepare earlier in the day or even the day before they're cooking a big meal. Thanksgiving, I pull out my like turkey pan thing at least a week ahead of time. One, because I have to find it because I haven't used it every year, but also because I'm going to be so busy with a million other things to prepare on Thanksgiving Day. I can sit instead of standing as I'm preparing vegetables if I'm going to make a soup or if I'm doing anything else. And maybe I can do that a day or two in advance too to reduce how much I'm actually doing day of. For hands, looking a lot at grip, especially with cooking. A lot of kitchen tools have thin handles, which can require a tight grip unless you use cooking. Knives and spoons, so increasing the diameter can really take off the load from your fingers. You don't have to grip it as tightly, there's less grip pressure going through your joints. Using a pot with handles on both sides instead of a pot that has one long handle. A great way to be able to use both hands to carry that heavy thing. I make a lot of pasta. I actually just keep my pot with two handles on the stove.
So these are a lot of great examples for things, but they're not things that are typically in a household. And I'm just wondering if there's any like grant funding to help with these tools, because like not only do we suffer with this, but then we have to pay more just to get a normal lifestyle.
I completely agree. You know, they want to pay for like insurance, have anything, but help a person get through the day of their life. Covan, I know, Covan. It is something you can get at the grocery store. It's still an out-of-pocket cost. It's hard. You try to look for a lot of community-based resources. I know that there are some organizations local to the Pittsburgh area that provide free thermal medical equipment. A lot of times it's the bigger items that you might expect, wheelchairs, crutches, being familiar walkers. Occasionally they have some smaller things too. It's a big barrier. I wish there was better. It's just like
They're like, here's your life, now go buy all of these things
Yeah.
and make it normal.
I know a lot of we give out hip kits for like anybody who's had hip replacement. I think that we should also have kits for this.
Kind of falls short for the chronics.
It really does. It absolutely does. Yeah. So yeah, these types of strategies are meant to help you not only get through the task a little bit more easily, but also conserve some energy, conserve some pain-free movement so that you can sit down, enjoy the meal, enjoy the time with your family, whatever it may be. So when should you see an OT? You would benefit from seeing an occupational therapist if your pain or fatigue are starting to interfere with your daily routines in any way. If you notice that tasks are taking more effort or more time, or that you're avoiding activities that used to be important to you or integral to your day, that's a sign that more support can be helpful. You can also benefit from OT if you're feeling inconsistent. Like sometimes you're doing things that you meant to be doing, and other times it's been harder for you to keep up with. And importantly, I would encourage you to seek support before your symptoms feel like they're totally unmanageable. Earlier intervention is really important. You don't have to suffer so much before you get the village that you need. And I thought this is a really nice picture. And if you want to be as happy as the man here, you should see them too.
Should probably not have it, right?
Yeah, or their routine is just really good. So the key takeaway is that you don't have to stop doing things that matter to you. You might just be able to find different ways to do them. And that's what I'm really here to support you and do it. So again, small changes like how you hold something, when you take a break, or how you structure a task, they really do add up over time. So one other thing to take away in addition to this message is that you have options. You have medical professionals, healthcare professionals that are here to help you figure out these hard things and even like more enjoyable. My objective is to help people add meaning to their lives. Yeah. So thanks for your time. If you have questions, happy to answer them.
You like COVID?
I do. I have some command comes in 1 inch size, 2 inches more. I did mention that it's self-adhesive with like that spray Covian if you have an allergy. And to some degree, it's reusable. You can like unwrap it and rewrap it. It won't last forever, but it's great. If anybody works for COVID. Yeah. But yeah, any other questions?
I don't have a question, but I was gonna say it's still out of pocket, so not helpful there at all. But the Arthritis Foundation has a really awesome program that's on, the police program. So they do have ones that are like through, like the Arthritis Foundation, like pens, through, I don't know if Covan's on there, probably. I know, it was like, they sent me tips before, like the IMAX ones, but it's also that's at least like relatively affordable that you can do with Amazon, CVS, Target, and a bunch of like different things. So it is nice because it's tested, third party for arthritis patients.
That is great.
Okay,
Thank you. Yeah. That's a good question. I imagine depending on where you're ordering from, you can be covered by an FSA or HSA account. That's definitely something. Especially if you can, because some of these things you can't get over the counter at a pharmacy. Yeah, I would imagine that they can do. I do have COVID.
Do you need your prescription to see an OT, or can I just call?
In Pennsylvania, you are required to have a referral from a doctor to be treated by an occupational therapist. You know, not to get too far into the weeds, you can have an evaluation to get set up, and we can get the referral after that evaluation, which is like the treatment that session. But it's easier to have that referral. I know I am happy to call providers for my patients to get those referrals sent over. So a lot of people do these.
Do those referrals come from a PCP or from a rheumatologist, or does matter?
I can get from any medical doctor. I can come from a medical doctor. I can come from us. Thank you, everyone.